Mr. Speaker, access to high-quality health care and good social well-being are very important to Manitobans. And yet the Broadbent Institute found that under today's NDP government, Manitobans suffer from the lowest social well-being of any province.
No question.
Most concerning is that Manitoba fared worst in the area of mental health.
Yes.
Can the Premier explain why Manitoba has the poorest rating on mental health of any province? Why has he not supported better access to psychologists to address mental health issues? And why did the Premier
lose half a caucus.
continue in yesterday's throne speech in a direction which has already failed?
We have the emergency center available for people with mental health challenges at the Health Sciences Center, first of its kind in Canada, Mr. Speaker. I was very pleased to be there for its official opening. What I saw there were health professionals that work in the community on mental health issues with people that work in the hospitals, forming teams, having a system that makes available care to people around the clock, Mr. Speaker, with specialized knowledge and skills, something not seen anywhere else in the country. That is a very significant advance forward, Mr. Speaker. We have early childhood development investments in Manitoba. And what we're seeing in those early childhood development investments is the research is showing that the mental health of young people that benefit from those programs carries with them throughout their entire lives, Mr. Speaker, whether it's elementary, junior high, high school, and into their careers as adults. The investments we make in early childhood development have significant long-term mental health benefits. In our smaller class size initiative in elementary schools, we've introduced a teaching methodology that we call PAX, P-A-X. And the results of that are very, very impressive, Mr. Speaker. Students are doing better. They feel better about themselves. They're resolving conflict in a more constructive way.
The Honourable First Minister's time has elapsed.
Mr. Speaker, surely the goal should be to address the mental health needs before people end up in crisis and have to go to emergency room. Mr. Speaker, with the number of psychologists available per capita in Manitoba trailing far behind every other province, it's no wonder that Manitobans have greater anxiety and depression and a poor sense of social well-being. Psychological health is a critical factor in overall health, yet this NDP government refuses to acknowledge the fact by ignoring the need for better access to appropriate psychological services for all Manitobans, as the government did in yesterday's throne speech. I asked the Premier, can he tell Manitobans why he thinks people in our province should continue to suffer until they end up in crisis in our mismanaged emergency rooms?
By the measure of one of the think tanks in the country, Manitoba has the shortest wait time in the country for psychiatrists. That is very significant, Mr. Speaker. We also have the Program for Assertive Community Treatment, what we call the PAC teams. And they are out in the communities working very closely with people to allow them to do well in the community. I was very pleased, Mr. Speaker, when Prince Charles arrived in Manitoba this spring, that we were able to visit the Sarah Riel housing project in the community of St. Boniface, an integrated housing project with people from the community living side by side with other people with mental health challenges in an environment where people were integrated. There was a high degree of dignity and acceptance of all the people there. A program started by a famous Grey nun, not so famous, but maybe should be more famous, a woman named Sister L. And that program showed that we're investing in housing to stabilize the lives of people with mental health issues. We're making other investments in housing projects all around Manitoba where people with mental health issues can have a housing first approach, where they stabilize their lives with safe housing. They get wraparound services, which allows them to get a better sense of themselves, a better sense of functioning in the community. And those programs are making a real difference, Mr. Speaker, and I commend them.
Mr. Speaker, the Premier says that the wait times in emergency rooms are short, but we heard a report not long ago that Grace Hospital and other hospitals had some of the longest wait times in all of Canada. Which planet is the Premier on? With this government, it is not just long wait times, however. In too many instances, the emergency rooms are not even open to help people. Mr. Speaker, I table a list of 750 days in 23 different hospitals in our province when emergency rooms were closed and inaccessible to Manitobans in need during the last 4 years. Why is this government so consumed with internal bickering and internal conflict that it can't even keep our emergency rooms open? And why did yesterday's throne speech completely fail to adequately address this critical issue?
The speech actually made very significant investments in health care, very significant investments, including more physicians, including more nurses, including quick care clinics and access clinics, including mental health services in the community, Mr. Speaker, all of which are at risk. And if the members of the opposition get into power because of their commitment to two-tier health care, and the member opposite knows. The member opposite knows very well that when he was in office, there was a 39% reduction in transfer payments for health care, social services, and community-based programs in the province of Manitoba as well as across the country. So, Mr. Speaker, I only say to the member opposite, if he cares about mental health services, vote for the throne speech, and then he will be on the right path to better health care in Manitoba.